I am a student at the University for Women in the Are program, and today I will be talking to you about drug/antibiotic resistance. By the end of this presentation, you will be able to understand what drug resistance is, understand why antibacterial resistance is a concern, understand how antibacterials work, be able to identify mechanisms of resistance to antibacterials, and be informed about strategies to contain resistance. Since the first use of antibiotics in the 1930s and 1940s, bacteria quickly adapted and developed mechanisms to escape their effects. Over the following decades, new antibiotics were developed to overcome resistance. Since 1990, new antibiotic development has fallen sharply, while bacterial resistance continues to increase. Antibiotic resistance is responsible for countless human deaths and billions of dollars in healthcare expenses. Some key terms: bacteria. They are microorganisms that have a cell wall but lack organelles and an organized nucleus. Virus is a biological agent that reproduces inside the cells of a living host. Antibiotics are drugs that kill or inhibit the growth of microorganisms. Resistance implies that an antimicrobial will not inhibit bacterial growth at clinically achievable concentrations. And MDRO is multi-drug resistant organisms. Bacterial infections. Some examples of a bacterial infection is pneumonia, otitis media, UTIs, which is urinary tract infections, and strep throat. And antibiotics are very commonly prescribed when a bacterial infection is present. Viral infections. Examples of viral infections are the common cold, influenza, and respiratory syncytial virus, also known as RSV. Antibiotics should not be prescribed for a viral infection. Viral infections need to run their course. However, sometimes antivirals are prescribed in order to shorten the lifespan of the virus. What is antimicrobial resistance? Antimicrobial resistance occurs when microorganisms change in their makeup in ways that render the medications used to cure the infection, it causes them to be ineffective. When this occurs, the microorganisms are often referred to as superbugs or multi-drug resistant organisms. What are superbugs or MDORs? MDORs are multi-drug resistant organisms that have developed resistance to one or more classes of antibiotics. These antibiotics can no longer be used effectively to control or kill these bacteria. MDORs are predominantly bacteria but can also include viruses, fungi, or parasites. The names of some MDORs identify resistance to only one drug agent, but they are frequently resistant to multiple drugs, such as MRSA or VRE. Why is this a concern? Resistant organisms lead to a treatment failure, which leads to an increased mortality rate. Low-level resistance may occur when antibiotics that are prescribed from a primary healthcare provider are stopped before the infection is completely treated, which in turn causes the antibiotic resistance. Drug resistance, it can occur in bacteria, which is the antibiotic resistance, endoparasites, viruses, which is the resistance to antiviral drugs, and fungi, As previously stated, drug resistance is more commonly seen in bacteria, but can also happen in viruses, fungi, and parasites. Faulty use of antibiotics or widespread use of antibiotics increase the probability of resistance. And again, antibiotics should never be prescribed for viral infections. How do antimicrobials work? Antimicrobials are agents that kill microorganisms or stops their growth. Antimicrobial medicines can be grouped according to the microorganisms they act primarily against. And with this, the concentration of the drug at the site of the infection must inhibit the organism from growth and also remain below the level that is toxic to human cells. Mechanisms of resistance. Intrinsic resistance is the ability of the bacteria to resist activity of a particular microorganism, which allow tolerance of a particular drug of antimicrobial class. And acquired resistance occurs when microorganisms obtain the ability to resist the activity of a particular antimicrobial agent. Next, I have a video for you to watch.
Some germs no longer respond to the drugs designed to kill them. In the United States, antibiotic-resistant infections cause an estimated 23,000 deaths and nearly 2 million illnesses each year. Resistant germs can spread in healthcare settings and are of increasing concern to patient safety. If patients are transferred back and forth from facilities for treatment without all the communication and necessary infection control actions in place, germs can spread inside of and between acute care hospitals, long-term acute care hospitals, and nursing homes. Infections and inappropriate antibiotic use in one healthcare facility can impact other facilities with whom they share patients, even those following recommended guidelines. Public health authorities and healthcare facilities within an area must work together to coordinate infection control efforts and prevent germs from spreading. This simulation illustrates that when healthcare facilities work independently, without public health involvement, they might not be alerted to resistant germs, C. difficile, or outbreaks in the area that could affect their patients. Without this additional information, necessary infection control actions may not always be taken, putting patients at risk for infection. If we continue with independent efforts only, where hospitals work on their own without coordination through public health leadership, modeling suggests that CRE, the nightmare bacteria, could affect nearly 1 in every 10 patients over 5 years. To quickly respond and stop spread in its tracks, however, public health departments should track and alert healthcare facilities to key resistant germs, C. difficile, and outbreaks in other healthcare facilities in the area. With public health departments coordinating among local facilities, these groups can work together to implement cohesive infection control actions and share their experiences with one another to stop spread. If facilities work as a team to protect patients, modeling suggests that 70% fewer patients would get CRE in 5 years. By expanding national efforts with coordinated antibiotic stewardship and infection control activities, we could prevent 619,000 antibiotic-resistant and C. difficile infections and save 37,000 lives from drug-resistant infections over 5 years. This approach is part of a national solution to protect patients from antibiotic-resistant infections and C. difficile. It will take leaders across sectors working together and making investments to protect patients and combat what is likely one of the most important infectious disease threats of our time.
Strategies to contain resistance. Development of new antibiotics, prescribe the correct antibiotic as well as dosage, continue treatment as prescribed, and educate. Education is key when it comes to antibiotic/drug resistance. You need to make sure that the patient understands to take the antibiotic as prescribed, to finish the entire prescription, and if patients are stopping antibiotics just because they feel better, the likelihood of antibiotic resistance occurring is high. And antibiotics, again, should not be...
My name is Victoria Nakum, and I know a lot about antibiotic resistance.
Antibiotics should not be taken with viral infections. Treatment with antibiotics. Infections that are caused by bacteria are treated with antibiotics. There are several different types of antibiotics available. Some antibiotics are better at treating certain types of infections than others. Antibiotics do not work for infections caused by other types of microorganisms, such as viruses or fungi. Using them unnecessarily increases the risk of bacteria developing resistance to antibiotics. In summary, the antibiotic resistance is a worldwide problem that is continuing to grow in concern. It is important to inform the public about ways to prevent antibiotic resistance. In order to do this, it is important to explain how to take the antibiotic prescription to prevent this. Education is key when treating an infection, as well as preventing antibiotic resistance. Thank you for your time.